right. Hello, CAMT world. Welcome to our interview with Amanda Brigham. And I'm Molly, the treasurer of CAMT. And Amanda, do you want to just do a little short introduction of yourself? And then I have 4 short interview questions for you.
Okay, sounds good. I am Amanda Brigham. Some people might know me or knew me as Amanda Bryant, which is my maiden name I had for many, many, many years. Partly because I moved here and started my private practice the same year that I got married back in 1995, and just had established myself as Amanda Bryant and kept that name for a really long time. But yes, I recently switched to my married name, and I'm Amanda Brigham. I did my undergraduate degrees in music therapy and music theater performance at Arizona State, which is where I grew up. And like many of us, relocated here due to grad school, but not for me, but for my husband, who was my fiance at the time. But my husband, Daniel, started grad school at CU. And so that's what brought us here. And we've lived in Louisville ever since then. My practice has evolved. When I first came to town, I took a position as the director of activities therapies for Lutheran Medical Center, which is now an internship program run still by Lisa Sprengler, who replaced me many, many moons ago. She's expanded that program. But while there, I was able to do a lot of program development. I'm during that time, in the mid 90s, I also was one of the founding music therapists for Adams Camp, which is where I met Molly.
Yes.
And had the opportunity to recruit many music therapists and work and truly hone my skills as part of an interdisciplinary team for Adams Camp. And about a year and a half after moving here and starting that program at Lutheran Medical Center, which is now, I think, part of the Centura system, healthcare system, I just expanded my private practice to full time, and have been in private practice full time since January of 1997. I developed many, many programs. That was back in the day where there were very few job postings, but I've always specialized in autism spectrum disorder and children through young adults with developmental or neurologic conditions, as well as vision impairment and hearing impairment. That same year that I started my practice, I was hired by Anchor Center for Blind Children. And I served Anchor Center for almost 19 years, a little over 18 years. And then I hired Molly. I didn't hire you, but I did. I strongly encouraged Anchor Center for Blind Children to hire Molly, and they did. And so I've been really fortunate to, I think, have been on the on-ramp of music therapy's growth in the state of Colorado, just because of sheer luck and timing, really. But I will say that I've always enjoyed program development and advocacy for our profession. And so that led me to develop many, many programs throughout the Denver Boulder area, such as Anchor Center for Blind Children, the music therapy program at Children's Hospital for Kids Street, medically fragile infants through preschoolers, Fisher Early Learning Center at DU, Jeffco Public Schools, Cherry Creek Public Schools, Boulder Valley School Districts. I've served clients, just a wide variety of program development, as well as growth of my private practice. These days, then I went back to school in my early 40s. I went back to school. I had done my NMT training kind of early in my career, and kind of kept up with that and became a fellow of NMT, just because of NMT's huge foothold with CSU here in our area. I think that led me.
And just to clarify real quick, NMT is?
Oh, sorry. NMT is neurologic music therapy
So for some who may not know, just
Yes, that's a good clarification. So I added that perspective, that clinical perspective to my toolbox a long time ago, but then went back to school in, like I said, my early 40s to CSU to study with Dr. Lugosi, and Dr. Knight had just come on then. And to really take a deep dive into autism and the neuroscience of autism. And because that was and is Dr. Lugosi's area of expertise, I felt in such good hands with her. And she let me really dive deep into social cognition and social communication, which is the bulk of my practice now. And so fast forward to today, I'm just about 99, 90 some percent clinic based at a community music school here in Lafayette, Colorado. I live in Louisville, but my practice is based in Lafayette, and do a wide variety of individual as well as small group work for mostly people, like I said earlier, with neurologic challenges like autism spectrum disorder. And yeah, and life is good. Next year will be my um 30th year in practice.
wow.
Well, since I did my internship. Yeah, so I mean I kind of count my year of my internship because
Yeah,
yeah,
sure.
I should have mentioned my very early career before I came to Colorado, right after completing my internship in California. After my undergraduate degree, I worked for Susanna Oliver with Neurologic Music Therapy Services of Arizona before we moved to Colorado. So I kind of started my my work as an employee of a pretty good sized private practice or a private agency in the Phoenix area right out of my internship, which was great. And Suzanne was a wonderful role model. I had really excellent mentors and models in my early years that I think helped shape me as a clinician. And I continue to be excited about our profession and the growth of it in Colorado and the number of students who now can take on full-time jobs or develop private practices here. It's really, it's heartwarming, and it's also affirming, for some of those initial paths that I like to think that I helped create.
Yeah, for sure. I would describe you as a trailblazer of music therapy. And,
Thank you.
for sure, as I was coming into the profession, it was Amanda Bryant, the music therapy goddess, who I just wanted to follow and know everything about. And I
That's
was so lucky to be able to get to know you and to to kind of follow in your footsteps a little bit, because you really did pave the way for me and for so many other music therapists to be able to do this good work. And the fact that you're still so um, on fire for music therapy, and so just such a great advocate. And now you're on the task force. That's not one of our questions generally for everybody, but since you are on the task force, you're at the head of the task force, maybe just give a little short little snippet overview of what the music therapy task force in Colorado is and what it does. And I
Sure.
think you pretty much answered all of my other interview questions anyway. So
That was a long, see, you get a long rambling bio when you talk to someone who's as old as I am, Molly.
as experienced as you are.
Thank you very much. I appreciate, it's very nice. Your words are really kind. So thank you. And I do stay, I think, eager and excited about our field because every day brings something different to me. I love the spontaneity and the growth that I see with clients and the creative challenges, the how we use music and the science behind what we do has grown so much, the data and the research, and that excites me. And just the endless possibilities that our tools give us has helped me, I think, stay or try to stay fresh. Um, and I think that's important. And I'm also excited. I've always felt excited by the growth of other programs and other people. I think, and maybe part of that just comes from my own non-professional personality of being an only child and liking and valuing social situations and relationships. But I like to help other people. I like to see other people grow and thrive and represent our field to the greater community, and that just that helps me. That helps me. It just it keeps that spark alive for me, I guess. But to answer your question about the task force, yeah. So you said that I should join the task force.
Oh, I was the one who got you started. That's crazy. It all cycles around.
Yeah, so to answer your question, Molly, you asked me to join the task force back in 2009. I know it was before, I think it was the year before I got pregnant. And it was also, right as Kimberly had started things. Kimberly Sena Moore, who is now a national team member for all the legislative work going on between AMTA and CBMT. She was then living here and heading the task force. She started it, and you had joined it, and you got me interested and involved. And along with Amy Wilson and Melissa Munder, I think we are kind of the core group of music therapists who are still involved on it. And we do a lot of advocacy, making sure that music therapy is represented accurately, making sure that people understand what we do, how we're educated, what our credential is. And lastly, we are still in the process of trying to seek state recognition of our credential. And we've gone after that, just to be really brief, we've gone after that in a few different ways over the years. But we most recently have landed on seeking title protection, which is the lowest form of regulation, but a good step forward, since right now we continue to have no state recognition of our credential, even though music therapy is a covered service in so many statewide funded programs. So that's what the task force is. And right now, I think we have 10 members on the task force, including then I came on as I co-chaired with Amy Wilson for a few years, and then took it on, I think, in 2018. Just, assuming the chair position. And we are an active working task force. It's definitely, there's
Hardworking.
there's always a lot of things to put our attention to, but we have a lot of strong support from AMT, from the national team. And so all the state task forces, for people who might not know, are part of a larger collective of work of task forces across the country. I think most states have a pretty good sized task force, or one that's starting to develop, for those states that haven't passed any state regulation yet. But I believe we have 13 states now that have passed legislation, and that includes either title protection, licensure, or a state registry, which would list who is board certified. So it is good work, but we have the support and the momentum of the national team behind us, which, their intent is to make sure that music therapy is accessible to everyone, and that people understand our credential and our education, and how to find a credentialed practicing clinician.
Yeah, that's great. Well, I think that kind of wraps up our interview, but thank you so much for all the amazing work that you have done over the years and continue to do for music therapy in Colorado. Um, and is there any last words you want to say about your practice or anything about music therapy?
Oh, I think it's great that CAMT is so getting so organized. I've served myself in numerous roles on the CAMT board through the
Yeah.
years. And I'm really excited that our state association is a nonprofit and that Elizabeth Linder and her team before you were able to get that done. And I'm excited that there are so many music therapists in Colorado. And I'm hopeful that we continue to grow, our reach clinically, and help connect those music therapists who aren't in the Denver metro area too, or in the I-25 corridor, from the Springs to Fort Collins, because I think there's so much potential for music therapy on the Western Slope and down by Durango and Pueblo and all those other areas that are growing. Um, and those people need our services. So that's exciting. Thank you so much for this opportunity, Molly.
Yes, thank you.
You're welcome.